guys, so I'm on call tonight. I'm just getting to the hospital now, and yeah, let's see how it goes. Hello guys, welcome to my channel. My name is Dr. Pepple. I'm a GP registrar, and yeah, I'm gonna be taking you with me on my night shift. So basically, I've just come in and met with the night team, and it's a very lovely night team anyways. We've got 3 nurses, 2 healthcare assistants, 1 assistant nurse practitioner, and a consultant who is not on site, and myself. Basically, what I do is just go through the routine for the night, which will be to see the poorly ill patient, to review drug charts of new admissions and those who need their medicines updated, to do some jobs that are left from the day team. If there are any new admissions, I will have to collect them in, initiate a treatment plan for them, and make sure that everything is followed. I mean, it's like a team, so we all work together, the nurses and everyone else. This night, my patients are all very stable and doing well, apart from one of them who seemed to be like the acute one. Basically, this is a young lady who was admitted because of worsening depression, and this has been affecting her sexual performance and, you know, the quality of her life. So she's the one I have to keep my eye on. So this patient has been on a certain medication group called selective serotonin reuptake inhibitors. It's one of those kind of medications which is to treat depressive illness. This night I'm going to be talking about sexual dysfunction, discussing sexual disorders and how it affects mood and mental illness. I'm gonna play a short video explaining the 4 stages of the sexual arousal cycle, which seem to be the same in both sexes, but a bit of variation in the female.
And when it comes to the sexual response in females, there really isn't a whole lot to say. The stimulus is the same as that of the males, and that's mechanical stimulation. And what the sexual excitement in a female causes is vascular congestion of the clitoris, and so the clitoris is erectile tissue, just as the penis is erectile tissue in males, and so the clitoris fills with blood. There's also vaginal secretions and nipple erection that occurs with sexual excitement. Now, as far as orgasms go in females, those are caused by rhythmic contractions of the vagina and the uterus. Increased blood pressure and heart rate will accompany that, and widespread skeletal muscle contractions.
The truth is, the more we talk about the issues surrounding sexual desire, sexual performance, satisfaction, and the more we talk about this, the more we get comfortable. It's quite an awkward topic to talk about, but it's something that's affecting the majority of the population, and it's causing a whole lot of mental illness, it's causing a whole lot of tension in family dynamics, and it's very, very good for physicians, psychologists, and caregivers to identify the problem and see how we can offer solutions. So when we talk about sexual pain disorder, it can be physiologic, it can be medical. When we say physiologic, it means it's not caused by an underlying medical problem. Medical means there is an underlying medical problem. So physiologic can be just, some people have spasms of the vaginal wall or the muscles around the vulva area, causing what we call vaginismus. Some other people might be poor lubrication because they haven't spent enough time to engage in foreplay. So because the mechanism of sexual arousal and sexual intercourse, especially in the ladies, because there is an elongation. The foreplay period brings about an elongation of the vaginal wall, and that elongation causes increased lubrication, and that increased lubrication brings about the ease with penetration and the ease with sexual intercourse. If you haven't engaged in that particular aspect of the arousal cycle, then there's bound to be pain. The side effect of medication, just as we've mentioned, for this patient which I have seen, who's been on this tablet that, you know, can decrease libido and because of that she's not fully engaged in sexual activity, and because she's not fully engaged, I mean, it comes to her like pain. Maybe from infection, probably a poorly treated sexual transmitted infection, or even a thrush infection like candidiasis, which is a fungal infection. It might be from previous surgeries, maybe even from a vaginal wall repair, episiotomy. Me as a doctor, my job is, when I see such patients, is to make them feel at ease, to take proper history and offer solutions. And sometimes you need to examine them. Do not forget, you need a chaperone. So you have to discuss issues of chaperone. You need someone else to be around, because I mean, it will involve some kind of sensitive examination, which you don't want to go all by yourself. So be it a female patient or a male patient you see, you need to discuss the issue of a chaperone, which will be someone of the opposite sex. If they say no, and if you feel comfortable to go ahead with it, document everything and go. But if you still don't feel comfortable, then you probably have to seek for a second or a higher or senior opinion. I'm gonna be doing videos sharing medical knowledge, especially about sexual reproductive health with you, and also sharing my journey, and also showing you various inspirational stuff about medicine, medical practice. At some point I might bring in some of my colleagues to show you stuff going on in the medical world, medical innovations, and things that will stimulate you and give you value for watching. So stay locked into this channel and share, like, comment, subscribe as well. Make sure you subscribe. Just hit the subscribe button. Thanks for watching, people. See you again next time. Bye. End of the shift. It's gone past 9 now. It's time for me to go home, get some rest and come for the remaining